Why does Medicare have to be so confusing? Hi, I'm Craig Smith with Craig Smith Insurance Group, and I'm a licensed independent insurance agent based in New York. Now, our agency specializes in Medicare, and I wanted to make this short video to help you understand how Medicare works in simple terms. It can be extremely stressful coming up on that 65th birthday with a huge healthcare decision to make. So sit back, turn up the volume. I'm going to hop back behind the computer, and over the next 15 minutes, I'm going to arm you with the right questions to ask when this pushy salespeople come a knocking. Okay, so let's get started. We're going to talk about turning 65 and your Medicare choices. So what we'll cover today is original Medicare, the 4 parts. You have 2 choices, a Medicare Supplement or a Medicare Advantage. What does Medicare cover? What is a Medicare Supplement plan and how to compare? What is a Medicare Advantage plan and how to compare? Part D prescription drug plans and important enrollment dates. Now, a little bit about myself. Originally from Long Island, New York. I started in the Medicare insurance industry in 2013, and we've helped hundreds of people find the right plan to meet their financial and health needs for Medicare. And I've been an independent broker since 2013. Now, if you have Medicaid, this may not apply to you, so the information, you can listen to it, of course, or you can skip to the end or give us a call at 917-740-1895. Now, there are parts of Medicare. You have Part A, which is the hospital insurance. Part B is medical insurance. Part C is a Medicare Advantage plan. And then you also, what that encompasses is Part A and Part B, and sometimes have Part D coverage. And then you have a Part D prescription drug coverage. Now, deciding on how you want to get your coverage. So you have original Medicare, which is Part A, hospital coverage. Part B, which is medical. Then you need to decide if you need a Medicare Supplement or a Medigap insurance plan. And then, of course, you need to decide on a drug plan if you need it. Now, then there's a Medicare Advantage, which is called a Part C, which combines Part A, Part B, and usually Part D. And then if your plan does not cover Part D, then you have to decide if you need additional drug coverage. Now, original Medicare Part A is hospital coverage. So original Medicare Part A is eligible at 65. There's no cost for Part A as long as you've worked 10 years, or what they call 40 quarters. Works with any hospital that accepts Medicare nationwide. Your Medicare benefits will restart after you're out of the hospital for 60 consecutive days. And once you've used your lifetime reserve days, they will never be available again. So if you're in the hospital for a 90-day stay, first, you would have the Part A deductible for days 1 through 60, which is $1,556. Then days 61 through 90, you would owe $389 each day, which means if you're in the hospital for 90 days, you would owe over $13,000. If you're in a hospital after 90 days, you're entitled to have what they call 60 lifetime reserve days, which you would pay a copay of $778 each day, which means that if you were in a hospital for 150 days, it would cost you over $59,000, and there's no maximum out-of-pocket or cap with original Medicare. You have Part B, which is outpatient medical coverage. Now, original Medicare, you're eligible at age 65, but you can delay it if you continue working and have creditable coverage. Premium starts at $170.10 per month, but could go higher depending on your income. Works with any doctor, any facility that accepts Medicare nationwide. Now, if you have to use just original Medicare Part B, you would be responsible to pay the deductible for Part B of $233. After you've paid the Part B deductible, Medicare pays 80%. You would owe 20% coinsurance. And if your doctor does not accept assignment from Medicare, then the doctor may charge an excess charge of 15% above Medicare assignment. Now, that doesn't apply to all states. For instance, New York, that does not apply to. Now, there's no maximum out-of-pocket or cap with original Medicare. Now, Medicare supplement plans, you must have Part A and Part B. You pay a monthly premium for your Medigap policy in addition to your Part B premium, cannot include prescription drug coverage, and costs may vary by company, by state, and by policy. This is what they call a guaranteed coverage, which means when you turn 65 or you first enroll in Medicare Part B, you have 6 months to choose a Medicare supplement plan without answering any health questions. After those 6 months, insurers can ask health questions and can decline your application if they wish. This is not all states, but a good portion of them are like that. Now, you can choose a doctor or hospital as long as they accept Medicare. It's accepted nationwide. You have standardized coverage, which insurance companies can sell you what they call standardized policy, identified in most states by the letters of the alphabet. This means that different companies can charge different premiums for the exact same plan. Quick chart of the different plans through the letters of the alphabet. Plan F offers what's called a high deductible. So if you choose this option, your monthly premium may be lower, but you would be responsible for the first $2,370, and then your gap plan would pay anything after that. And then Plan N pays 100% of the Part B coinsurance, except for a copayment of up to $20 for some office visits and a $50 copayment for emergency room visits that don't result in inpatient admission. Now, how to compare supplement plans. A Plan G plan or Plan N plan is the same plan from one company to the next because they're standardized. The difference is the premium that the company wants to charge. This is just a quick chart of showing how the cost of plans do increase over time. And of course, all insurance does go up over time. A Medicare Advantage plan, there are different types out there. There could be a 0 monthly premium to an $89 to a $98 a month premium. But you need to check that your doctor participates in the network. Your drugs are covered under the formularies. You're going to verify copays and out-of-pocket limits. And of course, it can change every year. Now, Part D prescription drug benefits. Prescription drug plans may have a monthly premium and an annual deductible. Prescription drug benefits work off a calendar year, which is typically January 1st through December 31st, and plans use a formulary, and this lists the individual drugs covered by the plan. Most plans have called tiers, and this is tiers 1 through 5, and each tier has a different copay or coinsurance. Sometimes you need pre-authorization. Some drugs require that you prescribe or contact a drug plan before you can fill certain prescriptions, and your prescriber may need to show that the drug is medically necessary for the plan to cover it. Quantity limits can come into play, and of course, there's what's called step therapy, which requires you to try one or more of a similar drug at a lower cost before the plan will cover the more expensive drug. Now, how to compare Part D plans. Each plan is unique. Don't decide by premiums or deductibles alone, and check your specific medications in pharmacy each year. Now, you have enrollment dates. With a Medicare supplement plan, your Part B effective date, you have 6 months prior to your effective date and 6 months after. So most carriers will let you lock in a price for your Medicare supplement plan up to 6 months before the Part B effective date. Once your 6-month enrollment period ends, you may have to answer health questions, and this means you could pay a higher premium or be denied coverage. Doesn't apply to all states, but there are many that it does. Now, important enrollment dates for original Medicare and Part D or Medicare Advantage. For a Medicare Advantage plan, you have 3 months before your 65th birthday, the month of your 65th birthday, and 3 months after your 65th birthday. You can enroll in Medicare to get Part A and Part B at ssa.gov. You could try to do it in person if you can find an open office, or you can call an 800 number. If you're already receiving Social Security benefits, when you turn 65, your enrollment is automatic. So you'll typically get a Medicare card in the mail 3 months before your birthday. Now, if you're still working and have employer coverage, you need to call your employer, the HR department, and verify that your coverage continues beyond age 65. So if so, you can still compare costs and cover to Medicare. And sometimes Medicare is a better deal when sometimes sticking with your employer coverage is a better deal. So it's best to compare the two to make sure you're getting the right coverage. Now, there's two ways to enroll in a Medicare plan. You can enroll directly to the company. They will just talk about their company. You won't get quotes from 20 different carriers. They don't talk about the rate history. They will help you with the application, but once they have your application, you'll probably never have any assistance from them. If you use an independent agent like myself, we will compare over 20 different carriers to make sure you get the right plan for your financial and health needs. We will review the trend history. We'll help with the application. We're here every year to review all plans to make sure you're in the right plan, help with Medicare appeals, annual Part D renewal help, and ongoing medication. So working with an agency like Craig Smith Insurance Group is free to you because agents are paid by the insurance carriers for bringing clients to them and providing back-end support. Now, a few benefits I offer. It's non-biased, an advisor on the ground, so I'm involved with all of the major carriers. We review your coverage every year, and there's no cost for my help. Now, to get in touch with us and learn about your options, you can call me directly at 917-740-1895. My email is craigsmith@csmedicare.net. Our company website is csmithinsurancegroup.com. And I'd like to thank you for taking the time to watch this video. And again, I'm just going to put our contact information back on the screen so you can jot down any information. We appreciate your time.